my name is Marcus, and today I'll be talking about a community-based initiative called Respect Yourself, Respect Your Culture. This initiative, I believe, began in 1993 as a way to address the prevalence of unhealthy behaviours such as smoking and drinking, which contribute to poor health outcomes for Indigenous and Torres Strait Islanders in Australia. In 2013, the Yirra Theatre Company flew out to remote Indigenous communities in Western Australia as part of Respect Yourself and Respect Your Culture 2.0. They asked the participants, who consisted of primary and high school students, what culture means to them. Reading through a number of peer-reviewed journal articles, Indigenous Australians overall view positive health outcomes through a holistic lens with a cultural understanding that incorporates body, mind, spirit and land, as well as environment, custom, socio-economic status, family and community. So during this initiative, the Yirra incorporated traditional dance with the kids in a group setting as a way to celebrate cultural identity and how they connect and teach them to be proud of their origins, which I think correlates with this holistic view of health. I think the initiative went into these remote areas because it's well documented that First Nations people living remotely are at a greater risk of preventable chronic diseases and have higher rates of unhealthy behaviours. If we have a look at the next slide, we can see the burden of disease that is quite prevalent in remote Indigenous communities. So here we can see in Western Australia, Indigenous Australians experience rates of disease of burden 2.8 times more than those of non-Indigenous Australians. We can also see that 19% of the total burden of disease was directly related to mental and substance use disorders, which include alcohol dependence. This statistic also captures both the immediate impact of alcohol consumption resulting in injury and the long-term impact of chronic disease. I think the Respect Yourself, Respect Your Culture 2.0 initiative recognised the social determinants to health that contribute towards inequality and poor health outcomes for Indigenous Australians living remotely, and is why they ventured out to remote WA communities. In the next slide, we'll be looking at the social determinants of health and the barriers that Indigenous communities face. We can see the geographical location. That refers to the limited access to health and education services like schools to inform individuals on making healthy choices, as well as the infrastructure like hospitals needed for these services. We look at a loss of culture. To expand on that, that's basically referring to colonisation, namely the historical experiences such as social exclusion, racism, trauma and loss of land, which also contributes to a lack of trust and open dialogue with mainstream services. Finally, the economics. So that refers to the policies created by governments who decide where money should be spent and for how long. This can often be subject to interpretation depending on who is elected into government. I'll now discuss the positive outcomes from the initiative on slide 5. We can see here it talks about celebrating culture. So it gives a voice to the First Nations people who are often marginalised and discriminated against because of cultural misunderstanding or acceptance. By accepting and celebrating the traditions of the Indigenous cultures makes room for healing and open dialogue possible, which leads to implementing culturally appropriate health services. Additionally, I believe the initiative promotes positive messages of cultural identity and healthy choices, and in doing so avoids stigmatising the group it aims to help. While the Grassroots initiative appears to have positive outcomes, namely the promotion of culture and sense of belonging, there doesn't appear to be a lot of quantitative and epidemiological data to suggest the gap between Indigenous and non-Indigenous health outcomes is closing. For example, if we look at the mortality rates, the gap in life expectancy between Indigenous and non-Indigenous Australians in 2012 was around 10.6 years for males and 9.5 years for females. So this shows that Australia has got a long way to go to close the gap. While this gap appears to be closing as Indigenous Australians living remotely are living longer, it must be taken into consideration people who reside in more affluent areas with more resources are living longer as well. In the past 10 years, for example, life expectancy has increased by 1.5 years for males and 1.2 years for females. I would argue the initiative adopted more qualitative research, which is important but doesn't address the lack of epidemiological data nationally or globally for that matter. Future recommendations for the initiative, for public health initiatives. Further government funding would be needed for the ACCHO and public health initiatives like Respect Yourself, Respect Your Culture across a larger national demographic over decades rather than years to determine if there are significant improvements in health of Indigenous populations living remotely. Also, as shown in the slide, future research and quantitative and qualitative data is needed at a national and global scale. In conclusion, the action on the social determinants of health is an appropriate way to tackle unfair and avoidable health inequalities. One study estimates that if action were taken on social determinants and the health gaps between the most advantaged and the least disadvantaged closed, 500,000 Australians could be spared chronic illnesses and $2.3 billion in annual hospital costs could be saved. That concludes my discussion on the social determinants of health in Indigenous communities, specifically in relation to Respect Yourself, Respect Your Culture initiative. Thank you.